Welcome to Healthcare in Context. My name is Charlotte Safrit. I am a breast cancer survivor, a caregiver, and a patient advocate, and I'm the founder and creator of charlottepxp.com. And this is my partner.
Hey, I'm Caitlin Holcomb, founder of Wellness Communities. I'm a certified community health worker through Baylor Scott & White, and shortly after earning my MBA, I quit my job to start focusing full-time on helping people to dwell in wellness. And welcome to our series, Healthcare in Context. We call it this because contextual care matters. In fact, evidence shows that paying attention to contextual care factors improves the likelihood of positive medical outcomes by 70%.
We want to remind everyone that we are not doctors. Anything we say here is not to be construed as medical advice.
So hi, Charlotte. I'm glad that we're going to be diving into your story.
Me too. I'm weirdly nervous, but I guess I'm ready to talk about my story.
I think you're ready. You'll do great. So why don't we start by having you give a little bit of background and context on your why for our audience.
So, many years ago, my mother had breast cancer, and I was her caregiver. And during that time period, my job was kind of to do the research to help her make decisions about what course of action she was going to take regarding her breast cancer diagnosis. And I became, I guess, a patient advocate before I really knew what being a patient advocate was. And she did well through that process. I remember I advised her at the time, she was stage 1, to get a lumpectomy because I felt like having a mastectomy was too radical and I didn't want her to have to go through it. And she got that done. She had to have scans every 6 months. From that point on, she had to have mammograms. And for 5 years, she had to have those mammograms every 6 months. And I remember she was so nervous. And she used to always complain about she had this big hole in her chest where it used to be, where it had sunk in. And she still had to get radiation. And she still had a lot of soreness associated with the scar tissue. And she always regretted not getting a mastectomy. So I always thought someday the chances are pretty high that I will also get breast cancer. And when that day comes, I'm just going to have a double mastectomy. So I was always very careful with my health because I understood that I was at a higher risk. I was also a caregiver for my mother because as soon as she got cleared from those 6-month scans, she was then diagnosed with thyroid cancer. And then after that, when we thought she was completely done with cancer, we moved away and she got diagnosed with small cell lung cancer. And I became her caregiver again through that experience until she left this world. And so I was always very vigilant with my health. I got married and had kids at a later point in my life. And I was very dedicated to breastfeeding because I thought, the longer I breastfed, the better my chances were for staving off breast cancer. But, I thought I didn't really have a whole lot to worry about because I was still relatively young. And
generally, you were right. That's what the evidence shows.
And I was in good health. I used to always pride myself on going into the doctors and being like, well, I don't have to check any boxes because I'd never had surgery. I'd never broken a bone. And then, I got diagnosed with breast cancer and I also had delayed imaging due to lactation. And that's really how I found myself in this path and how I became a more active and vocal advocate.
So, really, a path of two parallel stories that are of first being a caregiver and then experiencing it firsthand as a patient, being that driving why. Can you tell us a little bit about the diagnostic process with your mom?
So with my mom, hers was she actually fell down. She fell down and hit the side of her boob on a sign. She was a realtor, and it was a little bruise. And she said just the pain just never went away. And she was not keeping up with her mammograms, but that prompted her to go in because even though the bruise was gone, it still hurt. And that is exactly the spot where they found her tumor. Um, and that was how she found hers. So for her, I guess the diagnostic process was a little bit easier because she was old enough she didn't have to, fight for her imaging. And the doctor knew that her having pain in that area after the healing really was something to look at.
Why don't you tell us a little bit about your experience with the screening and diagnostic process?
So, as I mentioned before, I was breastfeeding for a really long time because I was trying to keep breast cancer at bay. And I was also very health conscious. I started getting pains in my chest. And I kept asking my doctors, was it anything to worry about? My mom had a history. I have a history. And they said, would you like to get genetic testing? You're still young. Most of the time, breast cancer doesn't hurt. So we're not really worried about that. And all of my doctors also told me that because my tissue was so dense due to lactation, that imaging wouldn't be able to read it. So there was really no reason to get any imaging because they wouldn't even be able to read it. Uh, and I remember thinking, but how long am I going to breastfeed? And how many other people are being told the same thing? And when the pain got so bad that I couldn't sleep at night, I finally went to a walk in clinic. And the clinician there said, hey, I think it's muscular. I can literally put my finger in it. You tell me exactly where it is. It's probably muscular. But due to your family history, I think at this point you've breastfed enough that your child has gotten enough nutrition. And it makes more sense to me to go ahead and schedule a mammogram. But remember, you have to be 6 months dry before they can read it. And I went home and I scheduled my mammogram, and the schedulers, called me and asked me if I had been 6 months dry, and I just lied. I said yes, because I thought, what's the worst that can happen? I get a false positive, and then I go in for a biopsy. At least I'll still be glad to know that they looked at it. And so I went in for my first mammogram 3 months later, and that's how they found my cancer.
And it is something noting for our own editing here. It is something important to note that the American College of Radiology no longer actually says that that is consistent, that you cannot have a successful mammogram while you're breastfeeding. That's no longer something that governing medical body actually says.
That's true. And I didn't find that out. In fact, I blamed myself for a really long time. I thought, I should have taken my health more seriously. I should have weaned earlier. I should have known to do this. And it wasn't until almost a year later when I had created a local breast cancer support group. And I noticed that a large amount of my new members were young breastfeeding moms. And I started talking to them, and I recognized that we were all in the same system. And some of us had absolutely no problems getting imaging, while some of us were told that we couldn't have imaging. And most of the people in that group that were told they could not have imaging um, caught theirs at a later stage. And I realized that this was a really big, consistent problem in my area. And I set out to see what I could do to address it because I mean, I don't know about you, but as soon as I had my babies, I can't think of any time in my life that I wanted to live longer and more than when I had just had my babies. And I started noticing statistically that our area, and not only our area, but all around the world, young breast cancer rates are rising. But our area specifically also has a higher rate than the general counties around us. And that's one of the things that got me started in speaking out against it.
Pivoting back to your mom and her screening and diagnosis process. You mentioned because of her age, it was relatively easy to go through, get screening done. Were there any other barriers or anything like that that she encountered in that early screening and diagnosis phase? For example, I know that you've told me one personal barrier that she felt was when she first started getting all of the information, it was just so overwhelming. She couldn't even process it. She just
Yeah.
had to push it to you to deal with.
Yeah. She felt like she didn't have the medical vocabulary, and truthfully, she really just didn't have the emotional ability to deal with it on her own. Luckily, I was there and I was able to support her. But I remember thinking to myself, what do other people do that don't have the support that she does, and thankfully I'm here. And she didn't even want to think about it. So she would just say, you look into it, you tell me what I should do. I would go to the doctor's appointments. I would take the notes for her. I insisted, for instance, we lived in a smaller city in North Carolina, and I insisted that we go elsewhere for her surgery. She wanted to stay in town because it was easier. So she had the issues of being in a more rural area and having to go somewhere else for treatment. Luckily, they were able to get her in fairly quickly because it was a lumpectomy, which is, usually a much faster surgical procedure. They can usually get you in a lot faster. So that was certainly a benefit that she chose that, I guess, in retrospect, which kind of makes me feel a little bit better. But certainly, that was in and of itself a challenge. Was geographic.
There are always would have, could have in hindsight, but the reality is that you're doing the best that you can do with the information that you're given in a very overwhelming situation.
That's yeah, I guess that's true. I guess that's what we all do. And I think it's a testament to how deeply we feel about the people in our lives that we always feel like we didn't do well enough for them. Um, it really says more about how much we love them, I think, than the situation sometimes.
I think that's a beautiful self-compassionate call out.
I try. So it's not always easy, but I try. And I think another one of the big for her a big one was just financial. She was always terrified about money. That was her big one thing my whole life was that she was worried about being able to pay the bills. She grew up in a sort of unstable familial environment because she was adopted by family members. So her way of sort of showing that her whole life was always being worried about, how am I going to pay the bills? She's always worried about, her housing. And so when she got diagnosed at the time, she wasn't on Medicare yet. So she had insurance and she had to pay the excess and she had a relatively high deductible. So she was really afraid of how she was going to pay all of those extra things. And sometimes I think if it had not been for me, she would not have done a lot of the things that she did do to try to stick around. Because, I mean, radiation, all of the extra things that you do to try to treat breast cancer and keep it from recurring, it's tough. And it's a long process if you have hormonal, receptive sometimes.
Beyond what you've talked about so far, were there any particular challenges or barriers in that screening and diagnosis part that stand out for each of your individual stories, or even as a common thread in both of your stories?
Well, when it comes to my mom, I think each one of her separate cancer diagnoses were, it wasn't hard for her to get the imaging because her doctors, the first time it was breast cancer, the second time with the thyroid cancer, her doctor was already more hypervigilant because of the breast cancer. And then with the third one, once again, it was the same, her family doctor who knew her. He was actually from the same hometown that she was from. So we were in Salisbury, North Carolina. He was from Henderson, North Carolina, and he grew up like a road down from her. So when she found him in Salisbury, he became her family doctor. So he was always very on top of things, very caring. He always gave her all of the time in the world to talk. And I think that that made everything so much easier for her. The main issues for her were really geographics. So for the thyroid cancer, she went to a hospital, I think that was about an hour away. And that was difficult during the diagnosis and surgical time period, but we were able to get chemo at her home hospital. And with the small cell lung cancer, once again, I was there. And that probably made things a lot easier. It didn't make it easier for me, but it it made it easier for her that she had someone that could sort of be the in between. So I spoke to her doctor first. She had called me. I had just lost a baby, and that next month, it was right after my birthday. She called me and said, I don't even want to tell you this, and due to our history, anytime she would tell me anything like that, my stomach would immediately drop. And she said, but they found a spot on my lungs, and they did a biopsy. I don't want you to worry, and I'll be fine. I'll let you know when I know. And I remember hanging up the phone, and I looked at Charles, and I said, get Colin ready. He was 2.5, and I was like, we're going to North Carolina. I'm taking him right now. I threw my 2-year-old in the car. I drove down to North Carolina. It took us about 12 hours. We got there the next day. I was riding around with her to one of her listings, and she got the call, but I answered it. And the doctor told us that she had small cell lung cancer. And I kind of had the responsibility of looking it up and telling her what that meant. Um, so that in and of itself was a difficult procedure, but really for her, I feel like diagnosis was a really seamless process, really for all three. And I think that that came from the caring relationship she had with her provider. For me personally, I had a really great relationship with my OBGYN, and I really believe she actually left my practice right before I got diagnosed with cancer. And I know it would have broken her heart to know that she had told me that, and that I had breast cancer. My PCP, I was at this weird time where she was getting ready to retire. So when I got my lab reports, no one called me. So I got to learn how to read a lab report and figure out what that meant. And I called the hospital, and I called my PCP office. I sent an email to my OBGYN office. No one called me. No one sent me an email back. I talked to the poor schedulers, and I said, "Isn't there someone that you can let me talk to?" And they said, "No, but you do have an appointment to talk about this next week." And I was like, yeah, but isn't there like a number that I can call where I can speak with someone about what these lab results mean? And they said, no, they're going to go over all that with you at that appointment.
How far out was that appointment scheduled from the time that you got the results back?
I would have to check my labs to remember, but I know it was at least a week. Yeah. So I learned how to read lab reports during that time period. Instead of sleeping, I stayed up all night long and I would look up every term and I would look up the research and see what that term meant and how it applied to my specific case and what the numbers meant. Luckily, due to my previous experience on the internet, looking up things from my mom, I knew where to go for the information. Because remember, back in 2008, when my mom was diagnosed with breast cancer, it was before there were so many medical websites and false medical websites. And so it was a lot easier. So I knew where to go whenever I went to go and look that up. But I just couldn't believe that there was no one for me to talk to about any of that. And I still think I wish I had known ahead of time that I could opt out or that there might not be anyone to call me.
I'm hearing two very important call outs in that. One, your comment on the prevalence of misinformation
Mm-hmm.
now versus 11ish years ago meant that it's easier and harder to, or it was easier in some ways back then to find the right, accurate, trustworthy information because there was less false information to wade through. And then your point about no one really telling you that they weren't going to call and review the results, or that based on the speed at which you told me your tumor was growing, it's surprising that it was a week before you had to even had the opportunity to discuss all of it.
Absolutely. And even when uh, we'll roll back to when I had the mammogram. So I had the mammogram, and actually it wasn't rolling back. So, but I had the mammogram, and they were scheduling me for a biopsy after the mammogram. The biopsy lab report is the one that told me that I had cancer.
Mm-hmm.
So, but the biopsy itself in the lab, which I was again teaching myself to read, said that it was BIRADS 5. So I was like, okay, so what that means is that it's 90% likely that it's cancer. So I was like, okay, we need to schedule this biopsy. And I remember calling the schedules and again, the poor schedulers. And I was like, hey, so you want to schedule me for this needle biopsy. And then you also want to schedule me for a, a different kind of biopsy. And why can't we just go in and like remove them? Like you know it's BIRADS 5. That means most likely it's cancer. Is there a place that I could go or anywhere that I can go that will just actually remove the lump so that I don't even you can look at it then, right? Because we know it's growing. And they were like, no, we don't really do that. And then I said, well, is there like a triage system? I mean, I imagine that the reason that like I have to wait this long is because maybe it's because I have a low grade tumor. Is that why? And she said, no, we can't triage like that. She said, we just have a lot of cases. So, I still, in that by itself, I think there's a lot to learn from that small interaction. Um, because I did look it up and there are places that actually do remove, especially at the time, I think it was less than 10 millimeters. So it was less than 1 cm. So it was like rice grain sized at that time. But by the time that I got it removed 3 months later, it was, I think, the size of a peanut. So it was 2 centimeters.
In just 3 months.
Yeah.
Hmm.
Well, that's not even including. So I include it from when they actually diagnosed me with cancer. So that was after the biopsy results. But remember, it took me a while to even get to that stage because I had my mammogram, then I had to wait on a biopsy to be scheduled, then I had to wait to talk to them, and then I had to wait to talk to the scheduler.
Did you see that kind of waiting with your mom?
No, no. But again, was a different situation. She was getting a lumpectomy. And they also, I think, I don't even know how her hospital treated it. It's so different when I consider her experience. I was just at the time I was, in my 20s, and I was just like, okay, so like we have to take you somewhere better. But I had no idea what that meant or what their policies were or how they treated breast cancer. And my own particular situation, I live where there's two big health networks and they both have different philosophies. So the first one that I went to uh, said that I had, let's see, triple positive, that it was ductal with lobular features. And um, they were okay with just doing a double mastectomy, no other imaging. The other one that I consulted with said that it was lobular with ductal features. I was triple positive, and that they would also like to have an MRI because they wanted to make sure they weren't missing anything. And they didn't explain why. And they told me that the MRI was 2 months out. So I was like, well, I can't wait that long. I want this out of my body. So then I think it was like a month into this that I was trying to figure out, who could get me in first. And at the time I was going to go with the one that wasn't going to do the imaging because I thought, well, they can get me in faster. So I was pursuing things with them. And then I found out about the reconstructive method that I chose, which was deep reconstruction. It's where they take your stomach fat and make boobs for you. And I was really interested in that. And I mean, we can talk about that in future episodes, but I was like, that is amazing. And I also found out that Penn Medicine, or sorry, I also found out that I lived really close to one of the places in the country that did more deep procedures than anywhere else. And I
Wait,
thought,
back up. Clarify what that procedure is.
the DIEP procedure, which is a form of reconstruction where they take your stomach fat and they do not damage your abdominal muscles, and they use that to reconstruct your breasts. And I found out that I lived like less than an hour away from a place that was doing a brand new microsurgical form of deep, and that they were doing more deep than anywhere else in the country. And I thought, like, I have to go there. So remember, I was a month behind. I had already consulted with two other hospitals. I was just waiting for them to schedule me. So I went in, I consulted with this other place. They told me, look, we do want you to have an MRI as well. But the reason that we want you to have an MRI is because if it's a later stage, we need to know so that we can treat you appropriately. So that would mean instead of having surgery, you would begin with chemo. And that's why we need to know. And that made sense to me that they explained it to me.
Took the basically the prescription for the MRI and took it
Mhm.
to your surgeon, and the surgeon was the one that connected you to get the MRI pretty much immediately.
Yeah. Well, I didn't even have to do that. She actually was just like, no, you don't even have to worry about that. You don't have to call anybody. I'm going to handle that for you.
That's
And that
good.
was one of the reasons I was like, this is my place. I'm so glad I came here. Right. And not only that, but in the end, I still remember right before surgery, it got to the point where my husband was like, which one are you going to choose? And I was like, whoever calls me first. I mean, whoever calls me to get this cut out of my body first is who I'm going with. And the last place I consulted with was able to get me in sooner. And I still remember asking the scheduler if there was any reason that they knew of that the other place just never scheduled me. They never contacted me again. And I was told, no,
Not even a follow up of, hey, I've been scheduled separately.
no. And when I asked about that, they said, well, it's probably because they saw in your chart that you were consulting somewhere else. And I said, but that doesn't mean I was going to use them. And how many people are just not getting calls back, and maybe they're sitting there waiting like I was, right? So I mean, but I mean, not everyone thinks like I do either. Not everyone is going to ask those questions. And that was yet another point of advocacy as I learned, later.